Welcome to the Surgery and Therapy Summit interview with Dr. Danny Pillay. Dr. Danny Pillay is a homeopath, Chinese medicine doctor, as well as a specialist in acupuncture. Dr. Pillay, welcome to the summit.
Thank you, Robyn, and I'm glad to be here.
I know you as a patient and have known you for many years. I once recall coming to you for knee pain, which was excruciating. And you blew me away because you said one thing, and I say this often, you said, the knee is just a bystander for the glutes, or something going on in the glutes. And you treated my knee pain with acupuncture, and I walked in with a 10 out of 10 pain, and I walked out with 0 pain. So you had me at the knee. So I'm so excited that you're going to be presenting on acupuncture for hand injuries at the summit. But before we go into all of that, I actually just want the audience to find out a little bit more about you. Do you want to tell us a little bit about your background and what led you to this field?
Absolutely. So partly, I'm glad that your knee got well quickly, so that's a good thing. So I grew up, in a family structure, coming from a Eastern philosophy of Ayurveda, natural medicines, and my grand would live till 100, and we got up with all these ideas. And having experienced some medical issues when I was young, realizing that allopathic medicine was only giving 1/4 of thought, and it got me to think into more holistic fashion. And so I did then study homeopathy, did a master's degree in homeopathy, and included in that studies was an auxiliary therapeutic course where I started acupuncture some 31 years ago, and then went and did formal studies thereafter. And so I've been in practice for almost 26 years in my own practice, utilizing homeopathy, Chinese medicine, and acupuncture in the main.
That's wonderful. So you're very holistic, and also I know that your focus is very much on your interpersonal relationship that you develop with your patient. I know that when I come to see you as a patient, I feel like the only person in the world, and that's a very special quality. And I'm assuming that's because you are assessing so much about the individual. You're looking at us so holistically. Can you tell us a little bit more about what you're thinking when we walk through the door and what you're assessing?
Well, there's a dynamic human being that has an internal interaction, which is physiological, sometimes pathological. In the bodily structure, there's a thinking, feeling human being that's operating in an environment. So if you look at the philosophies of Chinese medicine, it speaks about holism, about the integrity of the human being, mental, emotional, and physical, and how they interact with their social environment, other human beings and other beings, and how they interact with the environment. So we start seeing a patient not just as a conglomerate of symptoms, but a human being who's experiencing a life process. So a thinking, feeling human being. So I need to know, what is your temperament? What is your temperature like? What do you crave eating? What do you think? How do you respond? Because some people will respond quite differently to the exact same stressors. So we need to understand the individual. And so as much as we use diagnostic criteria, Western medicine will give somebody a diagnosis and say influenza. And so we'll base the treatment based on the diagnosis of the disease. When we're looking at Chinese medicine, acupuncture, or even homeopathy, we're looking at the individual. How are they responding? So 10 people can come to me with influenza and get a completely different treatment based on how they're responding. So we'll see with even the same infective organism, somebody's feeling chilly and somebody's feeling hot. Somebody's thirsty and someone's thirstless. So we're trying to understand the human being, how they're interacting with the environment. So yes, it is an absolute conscious effort to understand the totality of the human being. You've got to understand the patient. As the World Health Organization defines health as a state of complete mental, emotional, and social well-being, not merely the absence of disease and infirmity. So if we're truly going to provide a medical care, we have to traverse the entirety of the human being. And we are beings in a state of being. So we can't just look at static symptoms.
You're so right. And I think that one thing that taught us this recently is obviously the COVID pandemic, because there were people that made the decision to live and those that made the decision to die. Would you agree?
Absolutely. So also in a pandemic, one can see how people get affected differently by their state of being, by their state of what we call the constitution, their levels of health. It depends on what kind of being you are. If you're quite a robust being, then you're probably going to evade most infections. Even if you contract them, you can fight them off. But it's a case of understanding, even in COVID, somebody might lose smell for something and somebody doesn't lose smell at all. Somebody has got affected severe at multi-systems level, and somebody's just got an upper respiratory tract and got away, whether it's the same strain or a different strain. So there's a variety of factors. So this has got what we call susceptibility of the host. What is going on in the human being at the time when they're exposed to something that's infecting them?
And it's the
collision. Sorry.
And it's the collision of your thoughts, your feelings, your emotions, and your immune system.
Absolutely. So today we like to use grandiose terms like psychoneuroimmunoendocrinology. So basically saying your thought patterns, the way you feel and think, completely affects. If you're in a fear mode, you're going to produce a lot of adrenaline and a lot of cortisol afterwards. That's going to suppress your immune system. So if you're staying on long-term cortisol overdrive, you're going to be a weakened human being. You're going to have raised insulin levels. So you're going to be having more inflammation. So we have to look at the human being in totality. We cannot separate. I keep warning people that we must think in holism, because if we think just in organotropic ways, we're going to miss the bigger picture. If no two snowflakes are alike, how can a human with 90 trillion cells be the same?
Absolutely. And as you're speaking, so many patients I've treated flash before my eyes, thinking about particular circumstances where their pain presentation actually had nothing to do with the injury at all. And if we're going to do justice to our patients, we need to be astute enough to recognize that and to be able to treat them effectively. And there are those that can be active participants and those that can be passive participants in their treatment process. And we can very easily work those patients out. Do you agree?
Absolutely. But when you also understand the nature of people and the constitution, some people want to be recipients of care. They want to be, you the doctor, you the therapist, fix me.
Yeah.
Where others want to identify and understand themselves. What's going on? What have I done to contribute? What can I do to improve my healing process? So some of it is recognition. Of course, if you have a traumatic injury, okay, if you've been injured in a car accident, if you're a fall, that's trauma. But people, how they deal with the trauma influences the outcome. But it's also not looking just at the locality of the trauma. So the Russians have a saying, if you follow the pain, you will get lost.
Yes.
So it's very important to understand not just looking at the wrist pain, for example, if you're dealing, or the hand pain. So in Chinese medicine, we know that the liver plays a good role in governing some of the tendons and the musculature effects. So if the liver is not functioning optimally, the recovery rate is going to be less. So we have to look at all these levels when we're understanding it. So it takes a lot of integration. Therefore, it looks like I've zoned into you when you're in my rooms. Because I have to understand it totally. I can't just say, oh, wrist pain, and try and adapt to treat just wrist pain.
Yeah, absolutely. And you're going to be discussing this in greater detail at the summit, which is very exciting. Can you give us a little bit of an overview of your lecture?
Yes. So what I'm trying to would introduce is, obviously there's a paradigm shift. We brought up in a certain way, and we thought basically a Western way of understanding medicine, which is completely correct. But there are other systems and other thinking patterns. So my undergraduate studies in Western medical thinking, but going on to study Chinese medicine, and in my latter years of my studies in homeopathy and looking at Ayurveda or Nani Tip, realizing there's fundamental different philosophical thought patterns. And how can we imbibe all the different thought patterns to assist us in helping our patients and better understanding our patients? So part of it is looking at Chinese medicine and philosophy. So you'd be surprised to know that if you study Chinese medicine now, one of the prescribed textbooks is 1D Neijing, which, believe it or not, dates back to 2475 BC. It's a textbook that we still use here. So you've got a continuum of information that's used for 2,500 years.
Yeah.
And the youngest of the 4 books is Shangan Zabing Lung, which is 1,800 years old. So I won't cover all of these things, but give you the little gems of understanding and the evolution of medicine. Because we also have to understand it from that point of view, because it's a different paradigm. So understanding a bit of the philosophy, understanding a bit of the theories of meridians, yin yang, understanding how it works. It's completely, as I say, lateral thinking now, because it's something different from what you've learned for all these years. It doesn't mean you divorce what you're doing. It's just adding another tool. So, if you've never used ultrasonography for wrist injuries and something you've learned, it doesn't divorce everything else you've learned.
Absolutely.
So it's how to add another layer and also give you an idea to think differently, or perhaps refer to someone or work with someone in another field. And that's an important part. Then understanding local points, because as you've done with hand therapy and surgery, you're doing the right kind of things, but you're also unaware that there's things called meridians that run through these points and through these parts. So we've got 6 main meridians, 3 that run on the anterior aspect and 3 that run on the posterior aspect. And of course, you can use certain of these points to treat with acupuncture, acupressure, to treat locally hand, upper limb, upper extremity problems, but also from the hand to be able to treat other parts of the body, what we call distal therapy. So you can do local points and distal points. So the hand, very important to treat things in the head, for example, to treat pain, for example, in a large intestine 4 in the hand. So you can learn a lot about this and understand that there's things that you're doing in your professions all the time and just giving it another view and another look and another layer.
And be inspired to perhaps study acupuncture and be able to implement that treatment for our patients.
Absolutely. It is when I say to people, the textbook's 2,475 years old, they're suddenly completely surprised, because we kind of malign a lot of things that are not Western, like as if they sound, back end stuff, when actually there's information that's replete on all aspects of healthcare. For example, the oldest text in terms of pharmacopoeia is the Chinese pharmacopoeia. It's 900 years older than any Western one. We thought about Edward Jenner, 1796, doing smallpox. The Chinese were doing smallpox kind of thing in 1562. So there's data and documents around that. So one just has to be excited and hopefully enthusiastic enough to say, I want to try this too. I want to dedicate some of my time to understand these systems so I can better serve my patients.
I agree. And so just going on to hand conditions, can you tell us a few, maybe 1 or 2 conditions that you see regularly and what you're thinking or what you're trying to achieve when you're using acupuncture?
So we'll see, other than people have had your typical sporting injuries or sprains and strains, carpal tunnel syndrome. Lots of people, as you know now, they suffer from what I call Googleitis. They keep doing this, so you've got a lot of tenosynovitis. Those kind of things are very amenable to acupuncture. And obviously people that have had injuries or they've had surgical repair after getting a Colles fracture, we can do acupuncture. And then people who have things like neuropathies, acupuncture can help a lot. And it lends to people who are getting strained from having frozen shoulders that refer down into the hand. So again, it's not just treating the local points. So there's a myriad of things you can treat with acupuncture.
Absolutely. And with something like carpal tunnel, how often would a patient see you?
Depending on the patient, often a lot I've seen very effectively is women in pregnancy and carpal tunnel. So typically I would see the patient twice or thrice a week for about 2 or 3 weeks.
Okay. And so what's interested me recently, I'm not too sure if you've even heard of this, but nanotechnology patches, which basically are light therapy, phototherapy, that stimulates the skin to produce peptides in the body, which stimulate healing. And I've spent a lot of time doing a lot of the research, and it works very much with acupuncture points because of the Bongan channels, where the stem cells travel through the body in these channels. Can you tell us a little bit more about that? Do you have any experience with light therapy?
Indeed, I do, because we use other forms of light therapy, bioptron lights. There's a whole effects. We use laser on acupuncture points. So we know these kind of do. So the phototherapy you allude to comes in different forms. You talk to the ones with the patches that you place onto acupuncture points or stick onto acupuncture points. So they start emitting certain photons. They then cause your body to respond to them, and therefore you talk about the peptides. But there are many other effects. We know that by exciting them, you can produce more endorphins. You can create the inhibition of substance P, which is very important in experiencing pain, so it can decrease your pain sensations. We know when we use a phototherapy a lot for hormonal balances. So getting circadian rhythms back. So it makes perfect sense. There's a whole host of therapies, far less accessible to people, like a patch that someone can readily access. But there are ones that come from lasers of all kinds that have been used, and I've worked with them for probably the last 25 years.
Nice. So you have definitely got a wonderful holistic practice. So thank you so much. I think that we can learn so much from you, particularly with regards to the Chinese philosophy. I agree, it's just been around for so many millennia, that far, far older than Western medicine. And I believe that the world is starting to shift towards more natural remedies, towards working with the body, because the body can heal itself. Sometimes it just needs a little bit of help, and as you say, just a little bit of acupuncture or pressure in the right place. And I think that it's an important concept for hand therapists to really get to learn. And I just want to ask you one last question. Do you teach acupuncture? Where would you recommend therapists learn acupuncture?
So that depends on where. Firstly, just to say, I'm terribly passionate about this. So I'm glad when people want to learn, and information is really power when you have the right kind of information. It depends where your therapists are based. Each country, and in America, different states have different regulations. So you've got to make sure if you're studying something for the purpose of using it, that you're in keeping with the regulatory authority of where you reside. That's important. So you've got to make sure there's the regulatory bodies approve the training, because there are also people providing training that won't lead to registration. And if you're going to start practicing acupuncture, you must be registered. And of course, it has all the other legalities that come with it in terms of practice, scope of practice. So depending on which country, one has to search and see. There's different bodies governing it, and there's certainly regulatory bodies around the world in each country that govern it. There's no such thing as an international body per se. You have to have either state-based, as in the States, or country-based, as in South Africa, which we have the Allied Health Professions Council of South Africa that regulates and governs the training and registration of Chinese medicine, acupuncture, homeopathy, and the like.
Okay. Well, I think that's, I'm sure that there's a lot that people can research on that topic and find their particular professional body. And I also believe in mentoring. It's all fine and well to go and do a course, but to be mentored by somebody who's been doing it like yourself for 36 years, that's gold.
31, to be sure.
Oh, 31. Okay.
It's very important. See, we've changed the way we teach in the modern era. And we've got a very didactic approach to teaching in most of the Western context. Where Chinese medicine worked, you had to be with a mentor for 8 years. And he would then say, you've got the required skills, and I trust that now you can treat people. Okay. So it definitely needs it, because there's so many nuances. It's just about, it's not a thinking pattern of like Western medicine, say headache equals a painkiller.
Yeah.
There's 10 different types for headaches, and how to get this and how to understand patients. And there are the tricks of the trade, as it were, that only comes through mentorship. And I'm sure you're probably saying the same for your profession when you've studied as illustriously as you have. You've obviously learned a lot and acquired a lot that you can teach a lot of people. So for me, I'm passionate about education, and I look forward to helping people to stimulate their thought and be, incentivized to learn something new that can help their patients at the end.
Yeah, you and me both. I'm also very passionate about it, and passionate about the mentoring, because it's all about the nuances and it's all about experience. And sometimes in life we do need, it's not a shortcut per se, but it certainly makes us more aware of also what we don't know, even once we've done the studying and we've done the course. I find that with my therapists. They've done my course, but every patient is different and every presentation is unique. And that's where you draw on your experience.
Absolutely. That's why we call it a practice, because we are practicing. There's no perfection. There's learning and understanding. And the more we build the body of knowledge, the more we can apply to a new situation. So our education model is to give us more and more tools to deal with the next case. So that's why learning is never an endpoint. It's so important to understand different philosophies, because it's something that will not need Chinese medicine or acupuncture. It might need something else. So to have more tools, and even if you're not using it, at least you're aware of a tool that you can refer to. Often in rehabilitation, you're spending many consultations with the person. You think, aha, but maybe if we do this in addition, you get a result. And education is for me just an ongoing thing. I always recall one of my professors saying, our job in science is to push the boundaries of ignorance further away from us.
Beautiful. Beautiful. I love that. And that's a really good note to close on. Thank you so much for your time so that we could get to know more about you. I'm very excited about your lecture. And thank you so much for sharing your knowledge with us.
It's my pleasure. I look completely excited and thrilled to be part of this. Thank you.
Thank you.